Good afternoon, or good morning, or good evening, everyone. Thank you for joining the webinar. So this is the third in the series, third and the final, of a joint webinar that the social sector PPP group, which I chair, and the technology and AI chapter, which Thibaut Mouk chairs in WAP, has been conducting. And this one deals with partnership models for digital health and artificial intelligence. So in the first webinar, we looked at what technology and AI mean generally, and we started to relate them more to the health sector. And in the second webinar, we looked at some very specific applications and so on, and looked at the challenges and the benefits that go with that. And in this one, which is kind of more core to what WAP does, we're looking at the partnership models. And we're really fortunate to have an amazing lineup of panelists, starting with Thibaut Mouk is the head of technology and AI chapter. What I'll do, I'll introduce the panelists because we're going to be doing this more interactively, so it won't be one person at a time. So Thibaut is a finance professional, and he specializes in PPPs and focuses on sustainability and the people first dimension. He's advised several PPP units and organizations like the EU and African Development Bank. And he's a frequent speaker at international conferences. And within WAP, he has several roles as well as being a co-founder. He's also the chief editor of the WAP quarterly magazine. He founded Camden Advisory, which advises on sustainable finance. I'll introduce myself. I specialize in the structuring, negotiation, and financing of healthcare and education transactions in public-private partnerships, privatizations, and joint ventures. And I've been in this field for more than, well, almost 31 years. I've done all sorts of projects from strategy through to policy formulation to procurement and financial close. The digital health aspects really came in along with other digital solutions for social sector PPPs in the last 2-3 years of my career, where these really became more and more profound. And it's great to be doing this panel today. We have Dr. Tamara Sumbul, who is the Group Chief Information Officer for the Faqih Care Group. This is one of the big hospital groups based out of Saudi Arabia, but also with hospitals in other places such as the UAE. She has had over 31 years of experience driving innovation in clinical informatics and digital strategy. Prior to that, she was the former leader for technology and information at the Johns Hopkins Aramco Hospital in Saudi. Tamara is a household name when it comes to being a speaker and a thought leader in the field of digital health. And she has various leadership positions as well, for example, with HIMSS, with Zimam, with CLASS, various international organizations that look at how best to use digitization and digital transformation in the health sector. We have also Dr. Yara Abul Wafa, who is a digital health senior technical advisor and is part of a group called Health Enabled. She supports governments and partners in strengthening digital health ecosystems, and she has over 14 years of experience internationally, working across public health and digital transformation, and focuses on sustainable solutions that improve service delivery and patient care. She's had previous roles with UNICEF, with the World Health Organization, WHO, and ITU. We also have Mariam Misfriwi Raja, who is a specialist in digital health adoption and stakeholder engagement, and a member of the concept realization team. Mariam is also on the leadership team of the of WAP's technology and AI chapter with Tibor, and she's been actively involved with NGOs working on telemedicine and essentially using that for providing better access and equitable access to care. She's led strategic communication projects across 10 countries in the MENA region. She has conducted research where she explored how stakeholder engagement influences the implementation, appropriation, and sustainability of technology-driven health initiatives. And last but not least, Dr. Varun Goyal, who's a health specialist at Concept Realization and also runs a consultancy called Garnet Global Consultants. Dr. Varun is a health economist. He's a researcher and a project manager and also specializes in procurement and contracting. He has over 14 years of expertise in doing this type of economic and health economic analysis. And again, recently, he's been looking much more into the digital health solutions. He developed and implemented two very significant IT solutions for the Ministry of Health of India. One was used in over 11,000 Indian public health facilities. So without further ado, I'm sure you agree we have a great lineup of panelists here. We will start with the first question. So what I wanted really, first of all, to kind of set the context by saying that there is a strong imperative for partnering when it comes to digital solutions in the health sector. We look at the private sector having the agility and the entrepreneurship to actually want to develop these type of solutions. But at the same time, there's a tension there because these solutions cannot be said to be applicable or usable unless there is access to patients and to data. And of course, the largest holders of data on patients and access to patients are the health sectors, so the hospitals, whether they're public or private. And this means that there really needs to be a partnering solution so that the public side and the private side can get together to really develop these amazing technologies that not only bring in efficiency gain and so on, but really enable better access to healthcare and better outcomes for healthcare. Also, when it comes to partnerships, there is really a changing paradigm compared to more traditional infrastructure partnerships. So, for example, when we look at a traditional infrastructure partnership, we're looking at terms for 25 or 20 or 30 years. When it comes to technology, the technology expires much sooner than that. So there is really a need to look at a different partnership structure, different durations, even different payment mechanisms and KPIs. So I want to start with the question to the panelists. What, in your view and in your experience, is the imperative for partnerships? And let me start with Dr. Tamara, because she and I last year worked on a guide for United Nations Economic Commission for Europe, UNICE, where we developed guidelines for PPPs in digital health and as well as digital education and elderly care. So Tamara, what in your view and in your experience is the imperative for the two to partner?
So I think as the models change and we move towards digital PPPs, we're looking at a totally different infrastructure and actually total partnerships. With digital PPPs, especially in healthcare, we're changing the paradigm, right? So what you usually get with a regular PPP in terms of building assets, physical assets don't really exist. What comes into when we talk about risk sharing, so rather than financial, instead of looking at a hospital that we built and how many beds in those hospitals are actually occupied. We might be looking at totally different things when we move into digital health PPPs, like what was the readmission rate? What was the quality of a AI algorithm? So we're changing the way we view them, and we're changing the way we fund them, and we're changing the way we actually do risk. Because with the PP, you have to have that kind of shared, both of them sharing that kind of risk. And we're looking at a totally different, there's no asset, there's no key. So if things go wrong, there's not actually something that you end up with in the end. So I think just planning for that and funding that is very difficult. And as we move to this new era, we need to kind of reimagine what are the incentives that we're getting in together, and what makes it even more blurry, and it makes it more even harder, because nowadays you also have lots of companies coming up with software as a service, and the lines between that software as a service where somebody's actually providing something gets very blurred when I'm just a service provider versus that there is it's a real true partnership in which we're sharing risk. So it's becoming very narrow and very hard to differentiate, and that's why we need to kind of look at it again, and we have to look at what are those shared goals, what is that shared risk, and how do we address them? How do we actually change the paradigm of what we're doing now for the future? I think you're muted, Nasser.
That's better. Yes, thank you for that. And I'm glad you mentioned the software as a service thing, because yes, I mean that really becomes a form of a partnership, because you're really buying a service on a more open market that way.
But remember, it's not really, it is not a full real partnership because there's no risk sharing. So true
Well,
risk.
in a way, the risk that the
Oh,
provider has is in
yeah.
delivering a good service,
Yes.
without necessarily naming those. But maybe we can look at how that can become that. So,
Yeah.
I mean, we've seen this, for example, in the purchase of services. Not talking about technology solutions here, where the government will say, for example,
Yeah.
I'll buy dialysis sessions from providers, provided as long as they meet these kind of standards. And yes, if they then go to the next level of actually inspecting facilities, getting customer satisfaction surveys and so on done, then in a way they're introducing that. And it could
Yeah.
be that, yes, it starts as just buying software as a
And then it
service, but
goes
then
and it
we can
progresses.
evolve it so that it
Yeah.
becomes more akin to a partnership.
Yeah.
Let's hear from Varun next. Dr. Varun, go ahead. And I
Thank
think
you.
you're
Yes, yes. Thank you, Nasir. So what I think is like partnerships, they are definitely important in case of AI and digital health, as Tamara rightly mentioned, that it's not some kind of an asset. It's something which is invisible, but it's very important in terms of whether it is into public health system or it is into the hospital sector. It is a critical these days, the digital health and AI component, and also uh, it's a collaboration between the technology and the clinical practice and the public health system. So there are multiple actors who are responsible for these three different aspects of digital health and AI. Government is mainly responsible for public health system, and then the providers and the payers, they are responsible for that the healthcare is being delivered in hospitals, and then we have totally at the ground level the ASHA, ANMs, the community health workers. So I think there are multiple actors who are associated with whether it is an adoption of digital health or piloting of digital health or a scalability, whatever aspect we call, there are multiple collaborations and partnerships which are definitely require or imperative as far as the uh, digital health and AI solution implementation is concerned.
great. And Mariam, if we can have your perspective on that, so the imperatives for partnering. Muted.
Okay. Thank you, Nasser. So I feel like this first question ties directly to the messages I've shared during the previous webinar, because I've been proudly contributing to this series of webinars since the beginning. So for those who weren't there, let me just briefly recap the two lenses I've used so far, because it has the part of the answer. In the first session, I spoke about the system readiness and the invisible architecture that needs to be in place for any digital health initiative to work. And for the second, I focused on stakeholder intelligence and the strategic need to move beyond transactional implementation into a real alignment and trust building. So for this both session, I pointed the same idea that digital health is not just a technical transformation, but it's a partnership challenge. And this is the main what we are discussing in this session. So in my view, the imperative for partnership today, it's not only financial or operational. It's I would say structural and cultural. And I would explain it because if there is no trust, there is no adoption. In digital health, especially with AI-enabled remote care, we are not just introducing new tools. We are asking frontline workers to change the way they give care. We are asking patients to trust an invisible systems, and we are asking public and private actors to share control over really sensitive and complex processes. So this is if this is not done in partnership, it creates resistance. So if I was talking about trust, if it's not co-built, it becomes the first point of failure, I would say, for partnerships. And there is also an important element, the alignment, because what kills, okay, in my point of view, what kills innovation, it's not the tech itself, but it's the misalignments. We've seen many pilots that work technically, but die because the actors, whether if it's ministries, payers, startups, hospitals, are not on the same page. So they move at different speeds, they have different metrics, KPIs of success. So partnerships help us to create a shared frame of reference, a common language. It's important for outcomes, for accountability. Dr. Tamara was talking about risk sharing and the long-term commitment. So that's why the partnership we design must include not just funders and the implementer, but the ecosystem of adoption. And I would say the last it's the local fit, because every digital solution needs to be translated culturally, operationally, and politically, and we can't just copy paste a solution into a health system and expect the same impact if it works somewhere else. So what partnerships allow us is to co-design solutions that are locally adapted, socially integrated or legitimate, and the operationally embedded. So, okay, if I would say in short, the imperative for partnerships, in my point of view, is that we are no longer now just in a business of deploying a product or a solution. We are I would say, in a business of co-building a new ways of delivering care. And that means partnerships must become a design principle, not just something that we will think afterwards. So this is my answer to this question.
So it's kind of a do it with a partnership or it's not going to succeed. That's a very interesting, and I think for those who've worked in this, I'm sure Dr. Tamara and Dr. Varun, who implemented some of these, will agree with that really the partnership really brings the stakeholders together in a way that is very conducive to ultimate success. Great. So next we have Yara to answer the same question, and then Thibaut.
Well, thank you so much, and I agree with the points that have been raised by all the previous panelists. I think for context, like historically, PPPs have been widely used as a financing tool for infrastructure. So over time, it was mostly used to co-finance different infrastructure projects, starting with transport and then moving into social PPPs. And the incentives for those PPPs were largely financial. So most governments were using like performance-linked payments, as you were saying previously, so concession agreements, availability payments, and so on. So it was really linked to like contractual and financial issue. But this view, like this, like mostly transactional view of PPPs have been changing a lot with the digital and data revolution. And that, as also Miriam put it very, very well, the digital and data solutions is like it's imperative is like personalization and hyper personalization of care, and really creating and co-innovating and developing different solutions. So the transactional view of PPPs as a basically filling budgetary gaps isn't the new way of thinking of PPPs, but more of like shared value creation through mission-oriented approaches. And this has been done in like different parts of developing markets for other products, where usually the countries and the governments have a certain mission, and then they start rallying the private sectors and different investors and co-creators around that mission. And this is starting to happen now in like digital and health data. And the other point I wanted to highlight is data and digital are particularly different from the point of view in that it's like a non-rival and reusable asset. So it's not just a building, but it's a reusable asset in the sense that its value multiplies as you go with time. So the current like transaction contractual agreement wouldn't be able to take the view of what's going to happen with this data moving forward, and how do you basically try to understand the whole value of this data, not only now, but in the future, and take that into account of like current contractual agreement.
Again, a very interesting perspective there, Yara. Thank you so much. Thibaut, any last remarks on this?
Yeah, thank you, Nasser. To address the issue of the imperatives for partnerships, I think it's necessary maybe to take a step back and to understand how AI fundamentally reshaped PPPs in digital healthcare. And well, basically, just a few years ago, PPPs in healthcare were mainly transactional arrangements. So you have government and private company on the other side, which were contracted for infrastructure, for equipment, or for basic services with a straightforward model. The government identifies needs. This need is fulfilled by the private sector, and the patient receive a, let's say, static solution. But with AI, something quite different happened, and it forces us to reinvent the collaboration between public and private sector. And I would mention three main ways how these partnerships have evolved. First, we have with AI new dynamic and learning systems. As I said, the traditional partnerships delivered fixed solution, but now with AI-powered partnerships, we have evolving capabilities. For instance, the machine learning models that improve each time they get new data. algorithms which become more accurate, predictive systems which also keep developing. And so we need to develop a new framework for the contracts and the partnerships. So we need to adjust the contracts to be able to reflect those continuous change and improvements on the delivery of the services. We have to take into account the governance structures to enable this learning, ongoing learning. And we need to use success metrics to measure the performance rather than the deliverables. So this is the first issue, the dynamic system. The second is the importance role of data. Data is now a key in the partnership. Previously, central role was given to facilities or to equipment. But now we need to reassess the partnership because it's mainly the public partner which possess this data, patient data, population, health information, health records, and so on. While the private sector bring analytical capabilities and the computational infrastructure, and the innovation capacity. But this also raises challenges which we addressed in the previous seminar. Maybe we'll talk again about privacy, about sovereignty, equitable access to develop those new partnerships. And the third changes is the precision at population scale, because before AI, either you had a personalized care, which was resource intensive and available to few, or you had a very general population health program that were not tailored. And with AI, you can now deliver personalized intervention across the entire population and predict health risk using population data and optimize resource allocation. So we need to develop new schemes at the intersection of public and private to collaborate using these new possibilities. So this, for me, is the architecture of the new partnerships.
That's a very profound perspective. Thank you very much for that, Thibault. So I think having kind of set the scene in terms of the imperatives and some of these models, perhaps we can turn our attention to the enablers, like enablers for the partnerships. Just building on what we've talked about. And if I can ask each of you briefly to just talk about one enabler. Hopefully we won't have too many overlaps in your thoughts. But let's perhaps start this time in reverse order and start with Thibault.
I think data governance for me is probably the one of the most important enabler for new efficient partnerships. Because you cannot just transfer data from the public sector to the private entities. You need new federated approaches that will allow AI models to learn from this data set, but while the data will stay in the public sector environment. So we need techniques that enables privacy and protect individual information.
So data governance.
Data governance, yeah.
To enable privacy and security and so on.
So this is require a heavy investment from the private sector in the technical infrastructure. Sure. But also we need to design those governance models that will be adapted to these new challenges.
Yes, good point. I think it was Yara back in reverse order, yes?
Yeah, I think the enablers are usually based on the maturity of the ecosystem and of the country. One of the biggest challenges in PPPs are misaligned incentives. Everyone talks about that. So one of the enablers would be identifying the right incentives for the right partner at the right phase of the country's maturity. So lower maturity countries that are just starting with private sector investments and partnerships incentives could be like early mover advantage in shaping like the regulatory environment and becoming more of like a national standard. This is usually like a very high incentive for different private sector partners, and like higher maturity countries incentives is actually usually like different contractual forms and tax incentives and I don't know, like fast track regulatory approval. So incentives differ based on countries, but I think that's that I would say an enabler.
Interesting, and I like how you kind of separated it in terms of different economic status of countries. Mariam, I think you're muted.
Okay, so to make sure that I won't overlap with another enabler that some of the panelists can talk about, and to build on what I was saying earlier, I would like to bring a dimension that is often overlooked, but in my view, absolutely critical, related to the stakeholder, the orchestration of stakeholder across the project lifecycle. So what I mean is that in any digital health partnerships, whether if it's about deploying EMR system or launching remote monitoring platform or scaling AI-driven service, we deal with multiple actors. I'm not going to list these actors, but the thing is they are not just involved. They each bring different mandates, different time frames, different priorities, and fears. So if you don't orchestrate this, let's say, voices, the project gets stuck in misalignment. I was talking about, and Yara talked also about misalignment. Okay, she was talking about incentive, or worse, we can face a rejection, a complete rejection by this actor. So what I mean by orchestration is not just mapping the stakeholders, but also the dynamics between the stakeholder, who influences whom, who trusts whom, and also designing trust building mechanism from day one, not just consultation sessions. And it's also about aligning incentives early so that actor don't pull in opposite direction. It's also about creating shared KPIs and feedback loops, iterative feedback loops that everyone can see and use. It's also supporting adaptive governance that allows each partner to stay engaged. I was talking over time and over the project life cycle, even when the context shifts, especially in digital health, where the environment can shift very, very fast. So orchestration shouldn't be just a role, but it has to be a process and a mindset for the stakeholder. And this matters. This orchestration matters, and when stakeholder orchestration is missing, even the best design partnership, let's say, can fail. So I've seen like pilots of digital health collapse just because of informal resistance from nurses, for example. And I've seen also projects succeed only because someone was actively listening, translating, and aligning. I was talking about the common language. Yes, someone or or something in the process should include this translation so we can reach this common language. So in my view, stakeholder orchestration is one of the most and their valued enabler of successful digital health partnership, because we often talk about financing, technology, regulation, but without stakeholder orchestration, these resources can't flow and the impact can't scale. So if I have just to summarize, I would say that the enabler is this: design in partnership not as a contract, but as a living ecosystem, and make stakeholders orchestration a core design function, not something, not an afterthought. So yeah.
Thank you. Yes, yes. Yes, the way and the way you put it, it really brings it to the fore. Thank you. Varun.
Yeah, for me, like what I have experienced or learned is that there are two things. One is the vision of the policymaker who is basically working on or suggesting a particular digital health solution to be implemented to solve a particular problem. So the understanding of policymaker and how much he has the influence to drive the project, which I have understood is key to implement digital health projects at scale, so that and then how much time we have spent before we started developing or implementing a digital health solution. So how much time we have spent on planning and and identification of the key stakeholders and how they are engaged with each other, what kind of problem statement and how that will be resolved, and a vision for a digital health solution for, let's say, for next 10 years, and then the how that system will be developed and how it will be scaled is something which I think should be the prerequisites or enablers for any digital health solution to be scaled at the country level. So if those are my two aspects related to it.
Great. Thank you. And last but not least, Tamara.
Yeah, so I think from my side, I was going to say, I think also regulatory and government plays a really big role here. Especially when we said that we're moving away from asset focus to future ready kind of models, and that really they need to expand to include like data governance, digital IP rights, interoperability, cybersecurity, and definitely AI ethics. And the government can really play a big role here as a catalyst, because apart from just the traditional regulation, they can put in some policy incentive and outcome-based reimbursement models for digital care, regulatory sandboxes to safely test innovative models. And actually here in Saudi Arabia, we do have the two examples of those regulatory sandbox that have actually come out here to support that. And of course, definitely having those national data sharing platforms, like we're saying a while ago about data sharing. So you'll be able to have more data. The more data you have, the more value unlock across the providers, because that means you can have more stronger algorithms. And these can actually lower barriers to innovation and increase the private sector's confidence in digital investments. And I think also, apart from digital, more for healthcare, I think niche PPPs that we might see starting, like oncology networks, digital pathology exchanges, tele-ICU hubs, and a cardiac command center, and going into these kind of niche areas to provide like a scalable, sustainable innovation focused, rather than these large buildings that we spoke about before. So I think all of these kind of movement towards these kind of regulation sandboxes and specialized PPPs, I think those will be really big enablers.
Thank you. That was, thank you all, actually. I think you each gave very interesting perspective, and I'm glad we didn't end up with any overlaps. I want to move on to my next topic, which is really directed at Yara. Yara, when we were preparing for this, you said that you were doing some research in terms of partnership models for digital health. So perhaps you can give us the benefit of your knowledge in that sphere. Tell us about partnership models that you currently see operating in the digital health and AI space.
Yeah, sure. No, thank you very much, Nasser, for that question. So, one of the things I was working on is a systematic review on public-private partnerships. So, basically, what are all the different types of public-private partnerships that has been happening all over the globe? Where is it happening? What is the purpose of it? So, what we've seen are like three major buckets. One is the global multi-stakeholder alliances. So those are like big alliance by different like big tech, pharmaceutical companies, international organizations to try to converge on like high level agreements around how does digital health and PPPs look like, or like big mission driven directions. So this is, for example, are the different initiatives by the World Economic Forum, or like the cancer initiative within the United States, which they usually call like moonshot initiatives, based on like the moonshot initiative by the US government in the 60s to send people to the moon, where they try to bring alliances. And then the second thing that also comes up a lot are the strategic alliance. And this is usually not focused on specific service delivery, but it's between different types of partners like governments, private sectors, to align on things like data standards, data sharing agreements, regulations, or to work together to improve certain regulations to increase adoption of digital health technologies. And big part of the strategic alliances are happening in like high income countries. And then finally are the purpose-driven alliance, where you need to deploy like a certain tool or deliver a very specific service, which could happen between like national governments and a single partner, or like more regional governments, but it's a partnership that would end with something like a telehealth service for a certain region. So like yeah, in general we see like those types of three different types of partnerships, and they are used for different types of outcomes.
I think it's very interesting how you kind of put them into these buckets or different groupings. Any perspectives from any of the panelists on those? Tamara, I see you're edging to say something on that.
Maybe.
Yeah, Mariam, go
Okay,
ahead.
I pressed it. Okay. No, totally agree. I think it is definitely a whole new era that is coming up, and I guess we're gonna really need to change the way we run our PPPs and move to this. So totally agree with everything Yara said.
Mariam?
Actually, I don't have any other model or to present, but in my view, what I discovered, during in Geneva, where Lara was conducting like a really interesting workshop about the innovative model of partnerships in digital health. And I just wanted to say something that I would really recommend having a look of at the workshop report after this workshop, because it's a really rich in operational lessons, especially on governance, sustainability. And what I really found really interesting, because it's structured enough to be strategic and simple enough to be actionable. So I just wanted to add this, because when I discovered the model that Yara, especially the global digital health, I've talked about it somehow during the series 2 of the webinar, and I recommend to everyone who's attended to this webinar to take a look to the reports. Yeah, it's really quite insightful.
Thank you, Mariam, for the
Useful.
Nasser, you're on
I'm the
a...
one who's muted now. Varun, Thibaut, would you like to add to any of that?
Maybe a new model that is emerging is the national AI health platform, where the government provides the infrastructure and I mean the data and the regulatory framework, and on the other side, the private partners contribute with AI capabilities in different sectors or niche, allowing innovation in specific sectors and making sure that this innovation is oriented towards the public benefit. But this requires a vision from the government with a long-term perspective and a view of the development that are possible over the relatively long-term perspective to structure these arrangements. So it's slowly taking form, but it will still need a few years to be really operational.
Interesting. Any perspectives, Varun? I think Mariam also wanted.
Yeah, if you don't mind, Nasser, I don't know if we're supposed
Yeah, go ahead. Go
to know,
ahead.
but I have a question for you, Yara, when I was like rethinking about the global digital health monitoring that you presented last time. I would say that I don't know if it already includes this. So I'm saying this with all the curiosity, but I feel like there is one layer I personally find important to integrate. It's the agility factor. Nasser was highlighting the agility of the private sector, and then it's in digital health, the environment is moving so fast. So many of partnership in digital health can fail because of lack of, not because of a lack of planning, but they fail because of the context shift and the speed of change, and the governance or structure can't adapt fast enough. So I don't know. Okay, I'm just saying because I don't know if there is and let's say an additional layer that can be explored in this model that could integrate the capacity for agile realignment, stakeholder re-engagement, and adaptive governance over time.
No, I think that's a great point, Miriam, and just for the benefit of everyone, the Global Digital Health Monitor is a standardized tool that uses 23 indicators to assess the different factors that put together constitutes the enabling environment for the deployment of digital health in a country. It has recently been adopted by WHO as the standard maturity model for different countries, and we have more than 70 countries have completed the Global Digital Health Monitor over the past 10 years, and we work with countries to complete the monitor, so we understand how does it move. And one of the monitor's indicators is private sector engagement in the digital health ecosystem. And if the government is working collaboratively and is taking action to involve the private sector, and you actually have more than 70% of governments are not actually working actively to engage private sector. So that would be the first step. And the second thing, which does not directly address agility, but could be a proxy for it, is the governance structure. So there are some intensive questions around governance and understanding the governance of the digital health ecosystem in the country, and mostly based on the level of the governance. The levels move between 1 to 5, and based on the level of the governance structure of the digital health ecosystem, you can try to have a sense of the agility of the environment, but acknowledge that definitely the indicators could have one more layer of depth and detail.
Okay, thank you, Yara.
Tamara,
Can I-
go ahead.
Yeah,
Yes.
no, I just wanted to say something about because about in the Global Digital Health Partnership, GDHP, we actually did a full review of all these kind of digital maturity models, and we actually have a white paper that I'd encourage everybody to read. It will be available. We just finished finalizing it, so probably by the end of next week, it'll be on gdp.org, and you'll be able to find it there. And we did evaluate, including the Digital Health Monitor, a lot of those tools, and we really didn't really find one that was like kind of that would be usable by governments, because each one had less pluses and minuses. So we looked at different tools out there. There's a few that are coming out. Chime is coming up with like a governmental also basically tool that we use. HIMSS have also that global their monitor, although their maturity monitor is more based for they have the MRAM, but they also have the digital health indicator also. So the outcome of that was there was no size fits all. There are multiple ones. You have like there's going to be, if you open the toolkit, there's actually, we probably have we've reviewed over 35 different models, and each one has its like unique use case for usage. So one might be better for one type of technology or one type of maturity level, different than other. There'll be also cybersecurity things. So there's different toolkits there. So encourage everybody to read it. Unfortunately, I don't think we haven't found, as an outcome of the exercise, we haven't found a tool that would actually able to assist governments 100% saying, hey, we scored like this on this, so this is the one to use. But the one mentioned by Yaron is a pretty good one, and there's a few other ones that can be used for others as well as different use cases.
Great. I'm loving how this panel is interacting in this way. Cool. I want to just move on the discussion a little bit more, and this time I want to direct a question to Miriam. So you've talked a lot about stakeholders and so on, and of course partnerships do rely on a good level of stakeholder collaboration. So perhaps bring together some of the points you've already made on how you kind of design inclusive partnerships, but perhaps bring it into an example that you might have experienced or be working on right now.
Okay, so I think we all got the point that for me, designing inclusive partnership is not just a principle, it's a strategic imperative. It's about building relationship, not just checklists, sorry. It's about shifting the question from who is around the table to who has influence in the process, and how is this influence structured and sustained over time. So in my work across some digital health process, especially in low resources or fragile system, especially in Africa, I've seen time and that I've seen that the quality of stakeholder engagement will determines the legitimacy, the uptake, and the long-term sustainability of any initiative. And this is even more true in PPPs, where trust and alignment are something non-negotiable. So what does inclusion? You talk about inclusive partnership. What does really mean in practice? For me, let's say it rests on four main pillars. The first one is the stakeholder mapping, but beyond identification. I was saying this earlier, it's not about listing, but it's more about stakeholder intelligence. So inclusive partnerships, in my point of view, requires more than the stakeholder list, but they require stakeholder insight. That means understanding, interviewing, understanding who holds, whether if it's visible or invisible power, who will be impacted the most, directly or indirectly, and where the blind spots or historical, let's say, exclusion might lie. So in some of the missions I've used there is many tools about influence and interest grids, legitimacy mapping, network visualization to uncover the hidden dynamics, particularly for actors who are often overlooked but are essential for buy-in and the long-term success of a digital health solution. And the second point, I would say, it's the dialogue format. We have to adapt to power asymmetries and the realities on the ground, the local, where we are implementing the solution. Because one of the biggest failures I see is expecting that everyone to engage through the same formats. But inclusions means choosing formats based on who you are engaging and making sure that these formats are first accessible, whether if it's about language or digital tools or time zones, the literacy, we talk about the literacy, and it has to be also appropriate. For example, in public partnership, it has to be appropriate for the public or the private sector, the policy versus the field, and it has to be equitable. Equitable. I think in English it's also equitable. That means we have to give more voices to the less powerful actors. So personally, I've used everything from structure roundtable to iterative WhatsApp consultation, because what matters, it's not just hearing people, but it's also creating influence pathway from voice to decision making. And the last point is the trust building, especially when skepticism is the norm, because many communities and many public actors have experienced failed pilots, extractive partnership, or digital rollout that didn't deliver. So the legacy matters, and inclusion cannot exist without a deliberate and a visible effort to build trust through transparency about goals and limitation, through early wins that demonstrate value, and sometimes through explicit acknowledgement of past frustrations. I would like to highlight like something important in what's over the past few months. I had the chance to contribute to the peer review of the UNICE guidelines on stakeholder engagement in PPP, which will be launched next month. And these guidelines are not just theoretical, but they confirm what many of us in the field have learned intuitively, and they offer practical tools for designing inclusive stakeholder strategy from end to end. And I have many recommendations, but I recommend as well to anyone involved in digital health or infrastructure PPPs to consult these guidelines about enhancing stakeholder engagement in PPPs that are really valuable, and it had like a compass toolkit. And so you asked me, Nasser, if I can talk about like not only theoretical inclusive partnership, but about the concrete. So I can bring, this theory to life with the concrete example. Okay, it's about the partnership Babil project. It's a partnership between Babil, which is a subsidiary of Babylon Health in UK, and the Rwanda's Ministry of Health. It was, I think, launched in 2016, and it's one of the most well documented digital health PPPs in Africa, and widely recognized as a model of inclusive and scalable innovation. At the time, Rwanda had an ambition for digital health agenda, and it was aligned with their Vision 2020. Well, I'm going to make it short, but the Ministry of Health had already invested in a national systems like the health management information system, the community-based health insurance scheme, and a growing infrastructure of health post and community health worker. But one of the remaining bottlenecks, let's say, was access to qualified medical consultation, especially in rural and underserved area. So Babil entered with a proposal to deploy AI-assisted digital consultation accessible via basic mobile phone, USSD, voice, and SMS in, I can't remember what's the name of but in the local language. And this partnership was structured, 2020, bon. Babil signed an MOU, sorry, with the Ministry of Health. And then the company received a license to operate as a digital health service provider with conditions ensuring alignment with national health policies. And then Babil's service were integrated into the National Health Insurance Scheme, meaning patient could access them without out-of-pocket cost. And then the Ministry of Health retained oversight and governance responsibility, especially concerning the quality assurance, the data protection, regulatory compliance. And this governance balanced public stewardship and the private delivery. And it was a cornerstone of this partnership. And about the stakeholder engagement strategy, the success of this PPP is heavily, okay, plus or minus, heavily on a deliberate and inclusive stakeholder engagement approach, because they engaged with the ministry, Babil engaged with the Ministry of Health from the start, not just to get approval, but to co-design the integration process. And officials from various directorates, e-health, clinical services, insurance, were also involved. And about the community outreach and the trust building I was talking about earlier, the solution was rolled out with the support of community health worker who acted as local ambassadors, the educational campaigns to explain how to use the service, partnerships with the local leader and the women's group to reach vulnerable population. And there was also a multi-level governance forums, like a joint steering committee ensured regular coordination between Babil, the Ministry of Health, and the Rwanda Social Security Board, which oversees insurance reimbursement. I was talking also about the iterative feedback loops. Babil implemented a continuous learning model, collecting user feedbacks, analyzing usage pattern, and then adapting the interface and workflow accordingly. So for instance, consultation scripts were optimized for local symptom expression and the cultural norm. So just quickly, the result, I would say like just 2 words about the result and the outcomes of this project. I don't have recent data, but as of 2020, the service, had registered over 2 million users, so more than 30% of the adult population, hundreds of thousands of consultation monthly, and a significant reduction in waiting times and travel costs for patients. So the digital service didn't replace the public health system, but it augmented it, reaching users through channels they already trusted in a language they understood, because I said it was in the local language, under the protection, of systems that they believe in. So I think I overlapped.
Thank
So
you.
I don't
you.
think I'm be
No,
able to
that
talk about
was
another initiative, but okay.
no, that's good. That's good. I
Illustrate,
think
the
we yeah, I'm just watching the time. I think before I move on to my next question to Tiba, I want to I know Tamara's been itching to say something about this, so perhaps a couple of minutes on that.
Sure. I just wanted to add something. So, you were asking about inclusive partnerships, and I guess maybe going back to my kind of background, I think one of the important things is that multi-stakeholder partnership is that co-designing together, right? So bringing together not only the government and just one vendor, but and I think the example before was a great one, but it's not only those two together, but bringing in technology partners, clinical leaders, innovators, academic institutions. So when I say co-create and creating those co-creation models, I mean that the vendors co-design with clinicians and digital teams, so they come together and they work together to co-design and not just deliver just that technology. And local talent and startups embedded in those PPP structures, so that there's regional capabilities that we build. And digital sovereignty, because we know some of these things, especially when it comes to cloud and things like that, there's always an issue with where we're building them and how we're building them. And I will say, never forget that patients. So patients and communities also become participant in those digital care models. And it's very important to bring in those academic and innovation institutions that is connected through shared data and learning platforms. So these actually turn these PPPs into living innovation ecosystems, not just procurement exercises. So my opinion, these inclusive digital partnerships don't just deliver a system. We're looking for them to build capability, trust, and long-term digital resilience.
Amazing. And actually, before I move on to Thibaut, perhaps you can bring some examples of work you've done at Johns Hopkins or even recently at FP Group, kind of to just bring this to life.
Sure. I'll give you just something that we're doing right now with Faqih Care Group. So we have built an AI center of excellence. So we invested, Faqih Care Group invested 100 million riyals right now to build an AI center of excellence along with the partners.
Just to put it in context, that's about what, 20 something million dollars?
So no, it's around 28 million dollars. And this is from Faqih, right? So this is to build an AI center of excellence in healthcare. And the partners for that is the government, which is RIDIA, a Research Development Innovation Authority. And we actually got an external partner, which is who also joined this. And this is three-way agreement with Singular. So it was like with the private, with the government, and with another vendor. So when I talk about the co-creation and that multiple stakeholders, and why I think Faqih is a great let's say partner for that and bringing that with the government is, first of all, it has this university. So one of the first things we did was we went and we looked at how we're embedding AI in education, educating our clinicians, because we've never taught our clinicians how to utilize AI and what to do with that information and what to do with it. So part of it was that building that digital literacy that I was just talking about, those programs, building that digital literacy with your clinicians and bringing them up to speed. We started programs in the university that Faqih has and master's and PhD programs. The master's program is actually hands-on capstone project. Part of it is taking clinicians, whether they're physicians, nurses, therapists, and putting them through this program, and in the end, giving them something that they can do with their hands, and then being able to graduate with something that they've done in AI program, and they've actually delivered a product, and we've worked the whole cycle from A to Z. So it's not only knowledge, it's actually work. So I think bringing all that ecosystem together, whether it's academy, giving those our clinicians that are in the hospital programs on AI, whether it's working with our frontline clinicians and patients, working on tools that are improving AI, that digital front door, or working with our clinician on clinical decision support, or working with our operational areas and seeing how we can do process optimization, how we're leveraging AI and even chatbots and other things to actually make sure that make sure that people are working at the top of their license and they're not doing like meaningless things, and we're actually investing in more human capital and growing what people are doing. So that's the way when I say co-create, it's bring that whole ecosystem together with the different participants to deliver something.
Fabulous. Thank you for that example. Thibaut, I want to kind of change the subject a bit. And I want to ask you this question. Do you believe that development of AI technology has actually contributed to the new digital health PPP models that we're looking at and some of the examples that have been explained to us? And if so, what are the limitations and what are the future prospects for these kind of models?
Well, definitely, we've already seen a lot of developments. New models have been detailed even in this webinar. I think as time goes on, we'll better understand the capabilities and the limitations of AI, and we'll learn to adapt the models in function of this risk. In terms of limitations, I think we still have several challenges. The first one is maybe equity and access, because AI may even amplify health disparities. We must make sure that the digital divide do not create a healthcare divide. So to make sure that AI also provide benefits to underserved communities, and the algorithm trained on diverse population. So the public sector here again plays an essential role to keep equity at the center of AI. The second challenge is about sovereignty and control. When AI plays such an important role, what happens in case a private partner withdraws? How do you manage the risk? Who is the owner of the algorithm? In a way, the AI works as a black boxes, and this doesn't go well with the idea of controlling risk. So there are not so many easy solutions to this, but we can think of strengthening knowledge transfer between public and private sector. Maybe use open source components wherever possible, and develop the capabilities of the public sector. But also in the contractual framework, think very precisely about the risk issues and how they are going to be shared between partners in a way that does not stifle innovation, but still strengthen accountability. And this leads me to my third point, which is about trust and transparency. Miriam mentioned this. There is a lot of potential resistance on AI. So we must make sure that the humans stay on the front role in the health provision, so that clinicians may override AI in case they think it's necessary, and to have a strong accountability mechanism when things start to go wrong. So here, I believe the public sector needs to be very precise and deep in the analysis, and to make sure that trust and transparency remain key factors in those partnerships.
Great. So I want to, we have about 15 minutes left, and I've noticed there are no questions in the Q&A panel or even in the chat. So I'll pause here just in case there are questions from the audience, but otherwise, just look in the chat, see if somebody is typing anything or. Okay, in that case, we'll move on. I want to explore the issues of around insurance. And Yara, I noticed you've been very quiet, so not your fault, because we haven't directed a question at you. So perhaps we'll start with you on this one. We really, I mean, what we need to see is public health insurance schemes actually adapting to reimbursing digital health and AI utilization. I wonder if from the work you've done and the partnership models and the adoption and implementation of digital health and AI, if you've seen more of a move towards insurance schemes actually agreeing to the reimbursement, and I'm conscious you've also perhaps experienced this in different countries. But what are your views on that, and how are you seeing that trend?
I think one of the things that we've been seeing, looking at the different partners who are engaged in public-private partnerships, the least of them are insurance, either private insurance or public insurance. And I mean, we have a long way to go to understand why are the least companies that are engaged in PPPs are in insurance, but engaging insurance PPPs has also to look into, I don't know, like my thought also comes to private and public types of insurance, but that also has to look at different business models of the digital technologies to be able to engage with insurance, and different incentive models. And one of the most difficult thing to do, and also it's like a catch-22 situation, is how do you roll out digital health at scale to be able to prove cost effectiveness so that insurance can actually reimburse it, as opposed to like insurance reimburse it, so you're actually able to roll at scale. And this has been like a catch-22 situation that has been ongoing so far. And now different research groups are looking into how do you create new types of cost effectiveness models, or even move beyond cost effectiveness models into something that really fits the digital component. You're on mute.
The catch-22 situation you described is very interesting. And I think this is where partnership really comes into it, because, let's say there's a solution out there which the government, the ministry, the public health authority actually considers it will bring better access to patients, and so on. But there's going to be an issue with adoption.
Yeah.
And in healthcare, we always differentiate between demand and effective demand. So effective demand being demand that somebody can pay for. So if I'm insured under the public scheme, and if I go to see my family doctor, I don't have to pay anything. But if I opt for a digital consultation or something, then I have to pay. Chances are I'll opt for the physical, not the digital, not the online, not the telemedicine, and so on. On the other hand, if it's a reimbursed item and I'm not paying, and I consider that it's convenient for me to do it by telemedicine, or if if it's actually better because I might have something infectious and I shouldn't be walking around GP clinics, then I'll take that option. Now, this is, I think, where partnerships come in, because if the government sees that, and says, okay, I will, for example, guarantee a minimum number of patients. And then they work with the GP clinics to encourage the use. Or they perhaps have an availability payment and a usage payment to also encourage better service delivery with that. So in a way, you're kind of setting the framework for the private sector not to be exposed financially. And given that these technologies would typically have a relatively short time period, you're not looking at something that's depreciating over 20 or 25 years. It's going to be technologically obsolete probably in 3 years. So you really need that usage to ramp up fast. So the partnership model is quite progressive in that sense, because you can work on this at the same time at motivating people to use it, making it cost neutral for them to use it, and allowing that private sector innovation to come in. And by doing that and monitoring the adoption, monitoring the usage, monitoring the quality of outcomes, you're also then able to influence what the next generation of that technology needs to look like.
One more thing to add on that, Nasser. And beyond the insurance, looking at the digital technologies, there is a very big role for like a continuum of capital and different financing models for the digital technologies to be able to solve this catch-22 situations, and appreciating and also understanding that proving the effectiveness and adoption of digital technologies takes a longer time, specifically when it looks at like direct-to-consumer models in healthcare. It just takes much more time than what is the traditional investments look at right now, which is like big returns in shorter time. This appreciation that the healthcare is very much different is still not there. We've been talking about that for 15 years, but it's still not there. And now I think there are multiple groups looking at different types of investments like social bonds and other things to be able to finance digital technologies and improve.
Yeah. Yeah, Tamara, please.
Yeah,
And,
I just wanted to say something. So there's a lot coming in that area in terms of insurance. I think there's a lot of models that we now that we're seeing changes with. So for example, in KSA, we're seeing the big insurance company now, actually they're operating their own clinics. I haven't seen hospitals yet, but they do have their own clinics. So our two biggest insurance both have full clinics, and that is for other, it is a competition, right? So now they're also providing tele visits, population, and of course the whole aim of it is to actually basically make the population more healthier, so there'll be less healthcare. So in a way, it's good, but in a way, they're also coming into that space now. Digital tools are coming in really big, especially moving into that population health era and value-based care, in which we're trying to prevent disease. So they're a lot of them are asking, like even they're reimbursing now to get people to be seen by a GP and not just go to a specialist, so we can make sure that we get the right care for the person. They're increasing digital tools for patient engagement, so they're more health aware. And I think as we move into the new future, we'll be seeing a lot of different reimbursement mechanisms from the government to the hospital to healthcare systems in terms of pay per performance, value-based capitation, and we're going to change the way we do it, but rather than pay fee for service, and we're going to change to see how well can you keep your population healthy? What are you doing? How, and then that's when the value of digital tools comes, because there's no way anybody can do it with just people, right? So you're going to need those digital engagement tools, that digital front door, remote monitoring, and that big data exercise in which you know how to risk stratify your population, who to reach out to. So that is the new era that is coming in, and I think we're going to see a lot of changes coming in, and we've already seen the insurance companies already start with opening up their doors and opening up clinics across KSA.
Super. And I mean, I think especially in Saudi, it demonstrates how the role of the regulator comes in, because CHI,
they're really pushing.
Council for Health Insurance.
Yep, they're right across the street from me here.
Yes,
Yeah.
the CHI.
So,
the
yeah,
CHI are,
they're pushing
they're
hard
mandating that insurance policies that are issued by private health insurance have to have teleconsultations, et cetera,
and they're pushing population health extremely
Yeah.
And in the end, that is like better health, so less spend and better outcomes, right? So yeah.
Very good. Guys, we have a question. Thank you, Raymond, Saina, for this question. Let me read it out and we'll see how we can tackle it. We have 5 minutes to go. He's saying, great session. My question pertains to the current health models that we have. For example, different diagnostic models that are being used in all medical fields using digital means can speed up the diagnostic analysis, but using digital means to assess a patient's progress can be difficult because healing is not a linear process. Very well said. Hence my question. How can AI be used to capture healing process and avoid misreading indications of progress because a patient's healing process does not correspond to algorithmic prescriptive predictions? And he's apologizing for the length of the question. No, on the contrary, you put it very well there, Raymond. Who wants to put their hand up first for this one?
I'm happy to do that. Yeah.
Yeah, sure. Go ahead, Tamara.
So there's a lot that we do with AI. So right now, before your pathways, the clinical pathways were very linear. But nowadays, through AI, you're getting those basically generative models in which the model evolves along with your healing. And it's not only your healing from just the clinical standpoint. So before we used to more look at clinical outcomes, clinical indicator outcomes. We're moving away from that. And now we're moving towards patient-reported outcome measures, patient-related experience measures. So it's not only how you're doing on a health standpoint. So your doctor might think you're great and everything's perfect. The surgery went well. Your knee looks perfect. But then you might not feel perfect, right? Your knee still might hurt. And so your patient-reported outcome measure is different than the clinically reported outcome measure, different than the your experience measure. So that whole flow. So I think that is definitely also evolving from the standpoint of how we monitor that. And digital patient journey, the digital patient journey has really evolved. So it's definitely, we know 100% it's not linear. We're getting lots of more data points in, and these they call them hyper personalized pathways. And a lot of them are also derived off of your genomic information, because what might work for somebody might not work for you. So I think if you do a little bit of reading about those hyper personalized patient pathways, I'm sure you'll find a lot to come there. Hopefully there'll be more out there and more adopted in the future.
Great. We have 2 minutes to go. Any other points on that question, or we can just want to go around and just any kind of last minute, but 30-second blasts from each one. Let's start with Thibaut.
Yes, on the last point, I wanted to mention that AI is still not a mature technology, so it's going to improve over time. So it's important until it reaches more perfect. Yes, it's important that we build safeguards and we keep capacities to control what we are doing with
Very good.
with AI.
Very good. Okay, brilliant. Marianne?
Yeah,
Any closing comments?
Yeah, I would like to end with what Tamara highlighted, this co-creation, the value co-creation, including the patient. And I would just end with the one sentence and say that patients at the end will see the value of the digital health solution when we stop designing for them and start designing with them. So this is something really important, to include in the partnerships, including the patients.
Okay.
And the co-creation, the value co-creation,
Yara?
Yeah, I think my points, my final thoughts are going to be on incentives and risks. While we really understand the importance of right incentives, aligned incentives, we still don't have like a real understanding or a framework that defines incentives for different types of partnerships, different types of partners, and different environments.
Thank you. And last but not least, Tamara.
Okay. So for me, I would say the future of PPPs is definitely not about building hospitals. It's about building those digital ecosystems. And this is when governments, private sector, insurance, healthcare innovators all co-create around data, outcomes, and inclusion. And they don't deliver only infrastructure, but they build healthcare resilience.
Super. Really, it's been a fantastic webinar. Thank you. And by the way, Varun had to leave. He got a call from a client and he had to go and tend to it. So his apologies to the panelists and also to the audience. But really, I thought the points you all made were really superb. And I think the transcript should really be kind of turned around into some paper, because there was some very profound statements being made there and some interesting models. So we're going to work on that and maybe send it around and maybe put it as a paper on WAP, as a blog by all the panelists. I think it's really worthy of that. What do you think, Thibaut?
Yeah, definitely. I think it's a great idea, and that would perfectly fit in the WAP role for knowledge sharing on
Yeah, maybe in your
broadening.
journal, in your quarterly.
Absolutely, yeah. That's
Okay.
perfectly the place for it.
Again, thank you so much, and enjoy the rest of your days.
Thank you.
Bye-bye.
Thank you, everybody.
Thank you.
Bye-bye.
Thank you.
Bye.
Bye.
Bye.